Most doctors respect and obey their critical medical rule. They want to help, not hurt, their patients, but there are a few who seem to have missed this important message. They may look at their patients and see an opportunity to make money, or they may see a chance to vent their rage, or they may simply not care enough to be careful when taking care of people. Whether it's breaching the bounds of professional safety to cater to an aging pop star showing up drunk for an emergency room shift, being unable to diagnose something as basic as pregnancy, or wreaking havoc on your patient's genitals, there are doctors out there who you're better off steering clear of. Watch the video to learn about some of the worst doctors of all time. 10 doctors who should be avoided at all costs. Who are the worst doctors of all time? Take a look and see who are the doctors to avoid.
Number 10.
In Romania, Nelu Radulescu went to see Dr. Norm Siomu for help with his testicular malformation. During the 2004 operation, Dr. Siomu lost his temper, cut off Radulescu's penis, and then sliced it into 3 pieces. A plastic surgeon tried to save Radulescu's organ, but couldn't. Dr. Siomu was only barred from practicing medicine for 3 years. He also had to pay Radulescu damages, including money for an operation tried to reconstruct the penis from arm tissue. Shockingly, the doctors' union in Romania objected to the order to pay damages, stating that the precedent might lead doctors to refuse to perform operations. Given the outcome for poor Nelu Radulescu, maybe that's better.
Number 9.
A doctor in India was arrested recently when he showed up drunk for his emergency room shift. It may not have been the first time he knocked back a few before turning up for work. Local complaints said that he's been drunk on the job for years. Dr. Prabir Kumar Ghosh admitted he was intoxicated but said he had his reasons, one of which was that he was simply trying to relieve his joint pain. If only he could have got into a hospital for proper treatment, then this whole problem could have been avoided.
Number 8.
In 2001, the University of Washington admitted that surgeons at its hospital had left 5 surgical instruments in different patients over the course of 5 years. In fact, the hospital had just settled one case for leaving a 13-inch retractor in a patient when it discovered another 13-inch retractor had also been left behind in a patient. The hospital instituted new safety procedures, but this surgical department definitely has doctors you want to avoid. After all, mementos can be nice, but mementos that are forgotten in your stomach cavity should always be avoided.
Number 7.
For 5 months, her primary care physician assured Anita Arora that her periods had stopped because she was going through menopause. At 46 it was a possibility, but so was pregnancy. However, the doctor's office never thought to make sure with a pregnancy test there was another chance for someone to see the baby when Aurora had an ultrasound to check for gallstones. But again, no one noticed. However, it was suggested that she might want to eat a healthier diet to get rid of all that weight she'd put on. The pregnancy was finally discovered when Aurora insisted on a pregnancy test. Fortunately, the baby was safely delivered, and by other doctors than the ones who hadn't noticed the pregnancy in the first place.
Number 6.
There is a medical condition called pseudocyesis, or false pregnancy, which makes a woman mimic the symptoms of pregnancy: swollen stomach, no periods, morning sickness. However, the key word here is false. A quick look at an ultrasound will show that there is no baby on the way. Dr. Jerry-Ann Jesler and Dr. Dorette Grant were working at the Cape Fear Medical Center in North Carolina when a woman suffering from pseudocyesis showed up. When no heartbeat was detected on an ultrasound, remember, no baby equals no heartbeat, the 2 doctors rushed the woman in for a C-section, trying to save the distressed fetus. It was only upon opening the woman's uterus that they realized there was nothing inside. At least they noticed then.
Number 5.
At least the previous doctor was probably just an idiot. Dr. Yasser Awad, a pediatric neurologist in Detroit, stands accused of falsely diagnosing 255 patients with epilepsy in order to make money via insurance reimbursements. Like with Dr. Holton, patients had unnecessary drug regimes, but Drive Iwad took things a step further and also performed unnecessary surgeries to implant devices for controlling seizures, devices his patients didn't need since they didn't actually have epilepsy. So remember kids, get a second opinion before letting someone operate on your brain.
Number 4.
Some doctors show how horrible they can be in specific, isolated incidents. Dr. James C. Burt abused his patients for 22 years until the victims spoke out in 1988. Dr. Burt, a truly horrifying doctor in Ohio, spent years restructuring female patients' genitals without their consent. He believed that women were structurally inadequate for intercourse, a condition he thought his surgeries could fix, making his patients into horny little mice. Instead of unleashing his patients' sexuality, he created sexual dysfunction, multiple kidney and bladder infections, and the need for corrective surgery.
Number 3.
The previous doctor believed he could surgically alter his patients to create sexually supercharged women. Dr. Graham Reeves went in the opposite direction. Carolyn Guaginera went to see Dr. Reeves, an Australian gynecologist, to have him remove a possibly precancerous lesion from her labia. During the operation, he leaned over and told her he was going to remove her clitoris too. He added that since the patient's husband was dead, it didn't matter if he removed it, which he proceeded to do. He was sentenced to 2 years in jail for inflicting grievous bodily harm. His victim believed the sentence was too light, asking what sentence the court would give if a penis and scrotum had been cut off instead.
Number 2.
While working as a pediatric neurologist in England, Dr. Andrew Holton managed to misdiagnose 618 children with epilepsy, sentencing some of them to years on unnecessary drug regimes, which included side effects like blackouts and hazes. Many of the children simply had headaches or behavioral problems. If you wonder how Dr. Holton managed such a feat of misdiagnosis, it turns out he actually wasn't qualified to work in pediatric neurology.
Number 1.
Dr. Conrad Murray was just convicted for the involuntary manslaughter of Michael Jackson. He had prescribed the drug propofol, a surgical anesthetic, as a treatment for insomnia. However, Dr. Murray didn't provide the necessary medical equipment or oversight needed for the drug. Dr. Murray's medical license has been suspended, but even if he regains the right to practice medicine, he will always be a doctor to avoid. Thank you guys for watching, and subscribe, like and share for more cool videos.